Here is an example that we can look at and try to figure out the stage and grade for this case of periodontitis. So this patient is 29-year-old and she has type 1 diabetes, and it is poorly controlled, and she smokes more than 20 cigarettes per day. So the first thing that comes to mind when you see a poor glycemic control and smoking more than 10 cigarettes per day is that this patient belongs to grade C. So that was very easy. We know there is grade modifiers. So if it's uncontrolled diabetes, that means that the glycated hemoglobin test is 7 or more. Immediately we'll put this patient in grade C. Also smoking more than like 10 cigarettes or more per day will again put this patient in grade C. So when we look at the x-rays here, we can see severe bone loss, right? So see here, right? There. Now again we have some bone loss there, but you can see it reaches to the middle, or even here reaches to the apical 1/3 of the root. So again, and the patient is 29 years old. So of course, if you will divide the radiographic bone loss per age, it will give us definitely more than one. So this patient for sure is grade C. Now when we look at the chart, we will look for the clinical attachment class. And again, we will be looking for the worst site. So we can see here, we can see some 8, but we also can see here 9. So 9 would be the worst clinical attachment class, and we know 5 or more, that's stage 3 and 4, right? Now again, if you look at the forcation, we have forcation grade 2 here. So that's a complexity factor. So automatically we'll put the patient in stage 3 or 4. We have pockets, many pockets, more than 6 millimeters. So again, that will put the patient in either stage 3 or 4. Now there is no reason to think that this is stage 4, since we don't have any periodontal tooth loss or any of the other features like mobility grade 2 or something of that sort that would make us think about stage 4. So we can conclude that this patient is suffering from generalized periodontitis stage 3 grade C. Thank you.